most famous physical therapist on the internet.
Hi, folks. I'm Bob Schrupp, physical therapist.
Brad Heineck, physical therapist.
Together we are the most famous physical therapists on the internet.
In our opinion, of course, Bob.
Really humble opinion.
That's
Today we're
right.
going to talk about understanding bursitis of the hip and knee. We want to stop pain now.
That's right. Bursitis is no fun and be painful, but if you understand it, learn how to treat it properly, you can really decrease the time of pain.
By the way, we are doing a giveaway as we do every week. And just go to bobbrad.com. Go to the giveaway section, and you'll see that we are giving away a Booyah Stik.
Yes. And even Sam is partial to the Booyah Stik. Would you say that?
Yes, he does.
Yes.
He loves it.
Say no more, Bob. Shall we continue?
All right. What is bursitis, Brad?
Well, that's a good question. Bursitis, if you look at the name, bursa refers to a fluid-filled sac, and they're
right.
all over our body, typically by the joints. Itis means inflammation.
Right.
I believe that's a Latin term.
Right.
So it's inflammation of the bursa. So
It got flared up somehow.
and these bursa sacs have a lot of nerve in them, so they're tender and sensitive when they get inflamed, and it's not
They
fun.
can really hurt.
Yeah, it is. I remember my mom had it when I was a child in her shoulder, and boy, she was in a ton of pain. I really didn't. She said I got bursitis because I had no idea.
She couldn't spank you then?
Wow, so she let Dad do that. Anyways, shall we continue on here, Bob?
Sure.
Let's talk about the bursas we're talking about. We're going to show where they are in the hip and the knee.
Sure.
But how a bursa actually works. This is just a model way for you to think about it. Now, the bursa, we're going to talk about one on the hip. So let's say the greater trochanter. There's either a tendon or a ligament that goes over a bone. And so when you move, they have to slide over each other so they're functional, and it doesn't create any problems. But like my hands, if I did this, first I'll start feeling some friction and some heat. And if I did it long enough, I might even get some callus or some blisters.
And you irritated.
Yep, and it become inflamed, and I have sore palms every time I moved it. So what a bursa is like this ball. Now this ball is one of those squishy ones. It's got fluid in the middle.
Fluid-filled
Yep,
sac.
and if I put that in between there and squish, and I rub back and forth, almost no friction whatsoever. And that's what we want.
I like this demonstration, Brad.
Yeah, I thought it was
Very
kind
well
of
done.
fun.
Yeah.
You can do that forever, and it's no problem.
Right.
So...
Yeah, go ahead.
Well, the bursa's not needed anymore.
Yeah.
Let's talk about the location.
Sure.
Now, there is more than two
right.
bursas in the hip and more than three in the knee, but these are the most commonly irritated.
Right.
Cause problem. I don't have my pointer. I'll use my finger, Bob.
Sure.
So there's one right here on the greater trochanter. Okay, and then there's one little deeper inside, and that one is called for the iliopsoas.
Right.
And that helps relieve pressure and that friction there.
And that's, again, more on the front.
Yep.
And this one's more directly on the side. You
Yeah.
can feel the point of the hip.
To be honest with you, Bob, I've almost always worked with the one on the side.
Right. I've not seen the other one very often.
Right. With the knee, there's one right on the kneecap, right on top of the kneecap. And if that one gets swollen, I've seen those. It's pretty.
It's called like a housemaid's knee.
Yeah,
and
that's
plumber's knee. I mean,
it's
anybody
not
can
fun.
use a lot.
Then there's one in the lateral gastroc. That's a muscle here on the back of the knee. Okay, and the other one, this is probably the most common, I think, is the fibular bursa, which this bone is the fibula, and it's right up here at the top, and that can get irritated and tender.
With the IT band.
Yes. Yeah, thanks, Bob. Yeah,
So the band runs all the way along here, the IT band, iliotibial band, and it attaches to the fibula.
Sure.
And it can irritate that bursa.
So
It's tight.
we'll show you a little stretch later on to help cure that. But before we do that for treatment, it's similar treatment for all these bursitis. Number one is if you can, avoid the activity that irritates it.
Especially while you're trying to get it to calm down.
Right.
Yeah, we're not saying forever, but until you get it stretched out, or and do try some of these other things, avoid making it worse.
Right. Exactly.
You're not helping.
So hopefully that's a possibility. If it's part of your job, that can be a problem.
Right.
If you can't, but the next thing is use a cold pack over the inflamed or sore area. So a gel cold pack is nice and works well. Put it over for 20 minutes. Allow that to, and these are pretty superficial.
Right.
They're pretty close to the
Yeah.
surface of the skin, so the cold will penetrate through relatively good for most of them.
Or some peas, right?
Frozen peas.
frozen peas,
Yeah,
right.
that that's you use those and you got to break them up, and it works pretty good. I've had many patients be grateful, so they'd have to buy a cold pack, either corn or peas out of the freezer.
Right.
The next one is
A red flag.
a red flag, and that means if that bursa, if the skin becomes red, it's tender, it's warm, it's flamed, then you need to go to the doctor.
Yeah, we're worried about an infection.
Right.
So
Exactly
we
right.
wanna make sure that's ruled out.
Right. So that's a red flag. See a doctor, get that taken care of. Also, along with the cold pack, you can just go to the over-counter NSAIDs, ibuprofen, very typical.
Anti-inflammatories.
Yep, exactly. Take the right amount for your body size. Usually it says right on the
bottle.
on the bottle. Yeah. Or you can go to we've got a really nice video that's very popular
Right.
on the for
Ibuprofen,
Tylenol.
and Tylenol, yes.
Yep, even turmeric, if I
Yep.
pronounced it right. The next one, temporary use of a cane.
And you didn't grab a cane, did you?
No, I
Use
did.
the Booyah Stik.
Yeah. So if your left knee or hip is sore and you use a cane in the right hand and you walk with it, that's going to unload the pressure through the opposite leg when you walk, and that can make a significant difference. But don't get too excited. People do not want
Yeah.
to use a cane.
It's
temporary.
Right.
Yeah.
Let things just calm down.
Yep.
And
Exactly.
then go back to your life.
And I did want to mention, people are saying, well, how do these bursitises occur? How do they develop? Well, oftentimes it's a repetitive motion. Let's
Right.
say you started a walking program and you have not walked very much, and you start walking a mile, relatively quickly. That change change of repetition can get it started.
Right.
The other thing, let's say you injure your left ankle and it changes your gait, so you're limping for a few days. But
Right.
that change in your gait can change
It's amazing how little that takes.
Yeah.
I mean,
So things like that, things you don't think of. All right. Shall we show some?
also tight muscles.
Yes, tight muscles, they get tight over
By
time.
all means.
Yeah, and we could go on with that for another video.
Right.
Why these
In
muscles
fact,
get
that's
tight.
probably one of the best things you're going to do for this. Also, including the other regiment,
Right.
is actually do some stretching
Right.
of the muscles over the knee or over the hip.
Right. So should we start with a stretch for the hip?
Sure.
Yeah. So we're going to talk about stretching that IT band. One of them is when you're sitting. This will stretch it. This may not be the best one, but it's very convenient. Is the figure 4 stretch. I saw someone call this a pretzel, but I don't. I think it's a figure 4. Either way, that'll help stretch it. You could do this one lying down. Like this.
Yep.
I like
pulling
this
up.
one a little bit
Yep.
better.
That's really intense.
You can do it like this off the edge of the bed. Let's say this is my hip or my knee, and bring it back like this and allow that leg to go down towards the floor, and you'll get some stretch.
A
on
little
that
tricky,
eye.
but
Yep, exactly. You can use a massage gun,
Yes.
but you're not going to necessarily get too aggressive over the top of the IT band. You go up to where the muscle belly is, the TFL, which is up here, and you're going to massage that.
But actually,
area.
Brad, I've been reading about this a lot.
Oh, you have?
A couple authors have talked about this, how this band can kind of get adhesed
Okay.
down. So you do work your way along the band itself too. You're not going to stretch the band, but you're going to loosen it up.
Break it up, yeah.
Yeah, break it up.
So the band is actually where these stripes are. So you could go direct in, or you could go sideways.
Right. If you go sideways, it'll be less intense. You can also use the air-filled,
Oh
head,
yeah, that's going to be,
and that's going to be a lot more tolerable.
especially if you're a thinner person,
Right.
and there isn't as much muscle there. It's more enjoyable, so to speak. All right, next one we want to talk about for the knee, the quadricep stretch.
Sure.
So, depending on your balance, this is an example of a Booyah sticker. You put your hand on the
Right.
table or the wall, and you're going to stretch that quad out like this. Grab here, and this will stretch a little bit, but when you go down like this, you'll get a complete stretch, and you'll feel it.
Right.
Don't get real aggressive on these, but stretch it out that way. Hamstring stretch. There's a lot of different ways to stretch the hamstrings. What do you like, Bob?
I actually like to lie on my back and put my foot up on a railing. The railing, so it's just straight up like that. So I'm basically like this, and the railing's right here. And
so if this was
exactly,
and this could be a wall,
and I just move my body closer. Yeah, it could be a doorway.
Yep. So this is a wall, and this is going through. It's a nice way because you're so relaxed.
Right.
And it keeps it doesn't stretch your back in a way you do not want to stretch
exactly. You protect your back.
I like to stretch like this, keep the knees straight, back straight, and simply.
Yep, works out really well.
Yep, exactly.
You can actually just do it this way. You can lie on your back, pull your knee up like this, and pull your foot up even further. And that gives a good stretch to it also.
Now stay there once, Bob, because the next stretch is we want to stretch that gastroc or the calf muscle.
Sure.
So why don't you go up a little bit? You can get two at once if you pull the toes down.
And try to pull the hamstring straight.
It's a double header.
Or you can just simply go like this, and you can even take a belt or a towel and grab the forefoot and give a good stretch like that.
Exactly. Or this famous, infamous, easy wall stretch. Go like this. But you're going to need to keep the knees straight to get at the gastroc muscle as opposed to with a bent knee. Straighten it, heel flat on, toe towards the wall, not out to the side, and lean into that.
Well, Brad, they may be wondering, why are we stretching the calf when we're worried about the knee?
Well, remember, Bob, the second one, lateral gastroc bursa, is right back in here. So if you feel that pain in the backside, on the outside of the backside, that would be a good one.
That calf goes all the way up to the knee.
Right, yep.
The gastroc.
Exactly right.
So.
And it's one of those things, just to be complete, it doesn't hurt to actually stretch that.
It's a good muscle that tightens up on a lot of people, so that we want to make sure that it is stretched anyway.
Exactly. So. Well, Bob, we've bored these people enough with the infamous bursitis of the hip and knee.
Thanks for putting up with us.
And once again, we can fix just about anything except for
a broken heart.
There you go. And we continue to work on it daily, strenuously.
We'll make the news when we do fix it.
That's right. We're going to be on one of those news big ones, whatever they are. Goodbye.
All right. Goodbye.